Welcome to the CRISP Drug-Related Indicators Dashboard webinar on the Hospital Events Dashboard, non-fatal OD and SUD related. After today's webinar, you will be able to describe data available in the Hospital Events Dashboard, understand the data and aspects of the report, and apply findings from the Hospital Events Dashboard. For today's webinar, we will demonstrate how to access aggregate HSCRC data by running through a potential scenario highlighting the utility of the Hospital Events Dashboard. We will also highlight noteworthy data elements and examples of how to apply the data. To learn how to use the Tableau features within each dashboard, please watch the General Overview of CRISP Drug-Related Indicators Dashboard webinar. Health Services Cost Review Commission is a state agency that tracks hospital discharge/billing data. The CRISP dashboard contains case mix data for all unintentional or undetermined overdose-related inpatient discharges and outpatient hospital visits, including emergency department visits in Maryland, acute care hospitals, based on ICD-9 codes related to poisoning or intoxication. Codes indicating intentional self-harm are excluded. It also contains data on substance use disorder related visits, which include use, abuse, dependency of a number of drugs. The specific ICD-9 codes for SUD and OD related hospital events can be found in the Notes tab. Let's do a quick EPI review. As a reminder, remember that counts are the frequency of a particular incident or condition. This is useful in providing context to a problem, and it's useful with populations of interest when it's difficult to define them. A rate standardizes frequency to a common time period and population. This is useful when trying to compare frequencies of disease. It's important to be specific when defining your time period and population. In this dashboard, populations are the entirety of the zip code or jurisdiction. Both counts and rates are available in the dashboard measures, so choose wisely. As you remember from the General Overview of CRISP Drug-Related Indicators Dashboard webinar, the program manages a lot of data and may take a few minutes to load. So let's go to the dashboard. We are now going to review the tabs in the dashboard. Let's select the Non-Fatal OD by Patient tab. This tab displays overdose events by county based on the residency of the patient. Here is our scenario. I work for the Calvert County Local Health Department as a program manager. I am writing a grant for a new project with a specific focus on overdose-related hospital events. I will use the dashboard to gather statistics for the background section of my report. In my grant application, I am interested in describing trends in overdose-related hospitalizations in Calvert County in 2019. To do that, I am going to first press the pause button at the top. The pause button is incredibly helpful to save time as you go through the dashboards. I will now select pause to make it easier to select the other metrics. I will now change the dates so the time frame is 1/1/2019 to 12/31/2019. Since we are not comparing Calvert to other counties, we want to use the count option. The count/rate option is already set to count, so we don't need to change it. the overdose visit category already has all overdose types selected, so we don't need to change that either. We will now deselect all counties, then select Calvert County in the Patient County drop-down and select Apply. We will now press Resume so that the displays update. To view the result, hover over Calvert County, which is highlighted in red. The count shows that there are 206 overdose-related hospital visits among patients living in Calvert County in 2019. We will now go through the different displays available on this tab. The line graph shows the number of overdose rate hospital visits during the time frame you have selected. Each line shows a different overdose category. By hovering over the lines, you can see values for specific time. The patient by number overdose visits bar graph visually displays how many times unique patients have visited the hospital related to an overdose. The majority of people have only visited the hospital once for an overdose, yet there are many people who visit the hospital multiple times. This metric could be helpful if you are hoping to assess the need or evaluate the implementation of a peer program within emergency departments. Peers could reduce the number of multiple overdoses experienced by patients. By hovering over the first column, we see that 115 people visited the hospital one time for an overdose, while 33 people visited the hospital twice. The bar graph shows the counts of overdose visits by overdose type. The top bar shows the number for any overdose-related visit, while the lower bar shows numbers by specific overdose type. The two pie charts allow us to compare the state as a whole to whatever jurisdiction we have selected, which right now is Calvert. We will change the demographic variable to race to see how Calvert's demographics compare to the state. As we can see, Calvert County is 83.5% white, while the state is 50.16% white. You can also limit results displayed on the entire page by deselecting demographics in the drop-downs. Age group, gender, and race are available on this dashboard. The ED visit type gives information on what type of hospital visits occurred. ED with IP admission indicates the visit was to the emergency room and resulted in inpatient admission to an acute care hospital. ED without IP admissions indicate a visit that resulted in the patient being discharged directly from the emergency room. Non-ED overdose indicates an overdose that occurred while a patient was already admitted or in an outpatient appointment. The death flag indicates if patients died at the hospital as a result of the overdose-related visit. Expired indicates that a patient died, while not expired indicates that the patient was discharged. Please note, this dashboard shouldn't be used for a complete picture of overdose-related deaths, as most occur out of the hospital. Data on this dashboard is updated every month with up to 1-month lag. Each dashboard is updated based on how frequently the data set is available. The date on the bottom right indicates the date that the data on the dashboard goes up to. Now select the non-fatal OD by patient with zip code tab. This tab displays overdose-related hospital events by both county and zip code based on the residency of the patient, but limited to Maryland residents. We will now change the geography drop-down to select zip code. As you can see, the map now shows zip code. HSCRC requires the suppression of any value less than 11. The second tab also contains the substance combinations display. This graph shows counts of overdose visits by unique combinations of multiple substances. We will now select non-fatal OD by hospital. This tab displays overdose-related hospital events based on the location of the hospital. Each point on the map is the location of a Maryland acute care hospital. The data in this tab is helpful for presenting to hospitals in your jurisdiction. There is no rate option available on this tab due to the denominators being hospital populations. We will now select the SUD by patient tab. While the first three tabs have shown more specifics on overdose data, this tab shows substance use, abuse, dependence data. This includes any acute care hospital visits that included a substance use related ICD code. We won't go through all of the displays since they are the same as the first two tabs. As you can see, we have categories like nicotine and cannabis on this tab of the dashboard. Nicotine is the highest category of SUD types, so it can be helpful to review data without nicotine. As you can see, now that nicotine has been removed, we can see that alcohol and opioids are the highest category. We will now select the Notes tab. Under this tab, the specific ICD-9 and ICD-10 codes for overdose-related hospital events and SUD visits can be found. We want to review some noteworthy data elements. Please be aware that ICD-9 transitioned to ICD-10 in October 2015, and this impacted how events were coded. This transition is noted by a vertical line on the line graph. The death flag does not capture all overdose-related deaths in Maryland because only a small percentage actually occur in an acute care hospital. For a better picture of overdose deaths, users can view the fatal overdose dashboard covered in the next webinar video. We will demonstrate two situations and walk you through how to arrive to the data needed to answer the questions. After the demonstration, you can pause the webinar and go into the CRISP dashboard to practice the scenarios on your own and reference back to the recording. Scenario number one, or situation number one. Your community is seeing a continued large population of Black males overdosing and dying. Your team wants to understand and focus on the specific type of overdose that is happening within this targeted group. You also are trying to identify what, if any, interventions are missed between the first overdose event and the second. You are hoping that you can work to identify gaps and come up with interventions to prevent the second event. Here are a few questions that will help you get the answers. What was the rate of Black males in Baltimore City visiting an acute care hospital for any type of overdose in all of 2017? How many of these individuals had two overdose events during this time period? To answer the first question, you should be selecting the year 2017, rate per 1,000, all overdose types, male, Black, and Baltimore City. Your result should be 3.4 per 1,000. To answer the second question, you're going to look at the patients by number of overdose visits. You will see in the second column that our answer is 398. The second situation that we're going to look at is the number of reported overdoses in your county don't seem to reflect the substances being used or misused. You are looking to identify high-risk populations for OUD who have multiple hospital events to help increase their accessibility to services. You already have your county's overdose rates or prescription or prescribing rates for the previous year. Out of curiosity, you first want to look at all SUDs for the year. The questions here that will help you answer it are, what SUDs are we seeing are most prevalent in Anne Arundel County? How many individual hospital visits occurred for opioid overdose in Anne Arundel County by age for those under 35 years of age in all of 2017? What percentage of these people were male or female? To answer the first part of this question, you're going to select 2017, the count, all SUD types, Anne Arundel County, and then you should see this as your results. Nicotine is the highest, but if we eliminated nicotine out, we still see alcohol, opioids, and cannabis are the highest among all substances when it's distributed between male and females compared to the state. If we look at just the county for Anne Arundel County, we have 48% female and 51% male. If we look at race, we see that 72% are white and 22.4% are Black. To answer the second part of the question, you will need to go back to the non-fatal OD by patient. You'll select the year, any opioid OD, age under 35, and Anne Arundel County. You should see that there were 445 visits for that time period. If we look at the demographics of race, the breakdown for the county would be 89% white and 7.2% black. The third part of the question, we would look at the demographic breakdown, and we see that there are 26.7% female and 73.26% male. For your reference, here are the answers to the scenarios we just went over. You can use these to help go back to the CRISP dashboard and practice. Inclusion and interpretation of these results will assist you in reporting and presenting. If you have questions regarding the use of the hospital events dashboard, please contact mdh.overdosedata@maryland.gov. A user manual is available and will be updated periodically. As a reminder, all data should be considered preliminary. If you wish to publish reports with this data, ensure it is in line with the signed end user agreement, and please cite appropriately. Here's a sample citation. Here are a few Dashboard Pro tips. Please take a minute to read through this slide. If you have any questions, please contact the PDMP Informatics Unit at mdh.overdosedata@maryland.gov. Thank you for attending this webinar.